Hi, I'm Kate, and this is my presentation on the exposure to community violence. First, just wanted to tell you a little bit about myself. It's weird to be presenting to you and never seeing you as it is, so I thought this might take away some of the weirdness, at least for me. I attended Boston University for undergrad and received a Bachelor's of Arts in Anthropology, concentrating in medical and cultural anthropology. My senior thesis was about what is known as female circumcision or female genital mutilation. And in 2009, I moved to Atlanta for grad school. I received my Master's of Public Health from Georgia State. My concentration was health promotion, and my thesis explored whether teen moms could be taught to identify developmental milestones in their 2-year-old child. The hypothesis was that if they could identify developmentally appropriate behaviors, the risk or potential for maltreatment would decrease. Just to note, though, the moms I worked with had not been reported for abuse or neglect previously. After I got my MPH, I stayed at Georgia State as a project coordinator in the Center for Healthy Development. I ran a randomized controlled trial focusing on testing 2 different implementation strategies of evidence-based parenting programs to see what better met the needs of families at high risk for maltreatment. This is still one of the projects I work on. So in 2013, I started the doctoral program at the School of Public Health. I'm again concentrating on health promotion and health behavior, and my dissertation will focus on modifiable parental risk factors for child maltreatment, specifically substance abuse, maternal depression, and domestic violence. So before we get started, I just wanted to share my general perspective. It's my belief that when we understand the contextual factors of an outcome, we can achieve change for that outcome. That's kind of the underlying message or tone for my presentation. So let's get started. First, we need to define what we're talking about. Community violence is the exposure to intentional acts of interpersonal violence committed in public areas by individuals who are not intimately related to the victim. So, in other words, it's the intentional attempt to hurt one or more people by someone that's not related to the victim. The definition seems to be accepted by local, state, and international entities. And just to put it in other words, I read somewhere while preparing for this presentation that community violence is when violence comes to your door. It's the proximity of the violence that we're talking about, not necessarily that the violence is always directed at the individual specifically. So when we think about community violence, we have to contextualize it. It's the subtype of interpersonal violence. This week, we're also learning about exposure to family or partner violence, so I won't steal my peers' thunder, but I want to point out how these types of violence are related. As you see on the graphic, interpersonal violence includes both family or partner violence and community violence. On the family partner violence side, this includes child maltreatment, intimate partner violence, and elder abuse. In comparison, on the community violence side, it's broken down into acquaintance and stranger violence. Now, there's a number of examples of community violence. This is just a list, a small list I've put together from a number of sources, and it's very much not comprehensive. But my intention is to show you the spectrum of events that fall under the definition of community violence. This is an issue we're going to return to in a couple slides. So here are some examples you're probably familiar with: bullying, gang fights, shooting in public areas like schools and communities, robberies, sexual assaults, homicides. The list goes on. But one example you might not have heard of or thought of in this way is referred to as warlike conditions in U.S. cities. The graduate students might reflect on the book we're currently reading called There Are No Children Here. I would certainly say that the neighborhood in which the main characters grow up and live in would be considered warlike. In general, an act of community violence is often sudden and leaves victims in terrifying shock. This leads to a conversation about the effects, or you might hear the term sequela of community violence. As I said, there's not one kind of community violence. Similarly, there is not only one effect of community violence. It's different for every individual, even if they have a shared experience. It's also not just experienced by the individual. We've discussed the ecological model previously in this class. In my discipline, public health, we call it the social ecological model of health. The model outlines how multiple levels of influence affect an individual's health outcome. It looks simple, but it's a very complex model, and one must understand the interrelatedness of the levels. I think it's particularly relevant for the topic of community violence. On the individual level, what I've also heard called the intrapersonal level, this is biological or personal history that increase the chance of an individual becoming a victim or perpetrator of violence. Perhaps you've heard that those who are a victim are likely to be a repeat victim or actually become a perpetrator. This is where that falls in this model. The literature also hits home the trauma an individual may experience as a victim of community violence, and we'll definitely be returning to that in a few slides. On the next level, the interpersonal level, or what's labeled here as relationship, it's about the interactions between people. Here, consider how a victim of community violence would subsequently interact with peers or family members depending on what kind of community violence they experienced. Perhaps there's distrust or strain in a relationship that's essential to their well-being. At the community level, I think it's one of the most important, second only to the individual level. But here, think about if an environment allows for community violence, it's going to continue to happen. So, graduate students, recall from There Are No Children Here. This story takes place in a low-income housing complex in inner-city Chicago. Gang violence happens almost daily. The police and the community members clearly don't like that it occurs, but they're powerless, for lack of a better word, in trying to prevent it. This leads to the final level, the societal level, where norms come into play. In the book, it's the norm that violence happens, or that neighbors are victims of homicides and are arrested for violent crimes. At the societal level, the cultural and religious belief systems of individuals and groups of people come into play, and it's those systems which propagate situations for violence to occur. Policies here also come into play that create or maintain gaps between groups of people, and all of that leads to the violent clashes or tension that children are often exposed to. These are quotes from children describing the way violence has affected their lives. I won't read all of them, but just to highlight a few that particularly stuck with me. One says, "I'm afraid all the time, on edge, like something's going to happen to me and I can't be caught off guard." Next one, "My friends say I'm different since the shooting." And this one in particular really sticks with me. "I'm out of it all the time, but I need to focus on surviving so I won't be shot." So those words lead me to the conversation now about trauma. Trauma is an emotional and psychological reaction that follows a terrible event. The National Child Traumatic Stress Network defines two circumstances in which child trauma may develop. On the one hand, following the experience or witnessing of a serious injury or witnessing the death of someone, and on the other hand, facing imminent threats of serious injury or death to themselves or others, or experiencing a violation of personal physical integrity. Traumatic events can be acute, like a school shooting or an instance of gang-related violence, or they can be chronic, thinking here about abuse or maybe war. Traumatic stress occurs when the child or adolescent is exposed to traumatic events, and that exposure overwhelms their ability to cope. When a child is exposed to multiple traumatic events, they'll likely develop what's called complex trauma, and any trauma that occurs between birth and 6th is called early childhood trauma. So the effect of trauma is both short and long term. It can affect relationships with their caregiver, what's known as attachment there, and poor attachment has serious long-term behavior and emotional consequences. Trauma can affect development, and here it's physical development, emotional development, or cognitive development. It can make children prone to chronic health conditions that last their entire lifetime. For those of you who want to learn more about the effects of trauma, I encourage you to review the National Child Traumatic Stress Network resources online. They're very comprehensive. But if we're going to talk about trauma, we have to discuss the Adverse Childhood Experiences Study, which is known as ACEs. The original study assessed over 17,000 HMO members between 1995 and 1997 to determine the effect of childhood experiences, particularly those that were adverse, on later life health conditions. So it was a retrospective study. This means that they interviewed adults about what happened to them decades ago. I just also want to point out here that the study was conducted among HMO members of Kaiser Permanente in San Diego. The population, in my opinion, and also of many other scholarly critics, is that this study is not truly nationally representative, but despite these methodological issues, specifically recall bias and a not representative sample, the ACE study findings are still important, cited widely, and I think well respected. This is the original ACE study publication. Vincent Folletti and Robert Anda were principal investigators and are very well known. The study investigated 7 adverse childhood experiences: psychological, physical, or sexual abuse, and then indicators of household dysfunction, substance abusing adults, adults with mental illness, violence against the mother, and other criminal behaviors, specifically incarceration of a family member. Later, ACEs have come to conceptually include other experiences like child neglect and also divorce. But this original study, in a nutshell, it found that individuals who experienced a greater number of ACEs had poorer health outcomes later in life. This table shows the prevalence of these ACEs for the 17,337 men and women from the original study. So 2 things you need to take away from this. ACEs are not uncommon, and it's likely that an ACE does not happen in isolation. So what have we learned so far? A child exposed to community violence is likely to experience physical, emotional, and social consequences, specifically trauma, and these effects are both short-term and long-term. And if it's not obvious, I'll just say it. For social workers, for public health professionals, working with families and children who have been exposed to community violence is complex and frequent. We should also be aware of the fact that parents of children who are exposed to community violence are also likely to have been exposed to some form of community violence as well. In other words, there's a high public health burden of the exposure of community violence, and the impact for social workers is both personal and professional. Working with these children requires self-care and strategic professional service delivery strategies. Is this you right now? Because it is certainly how I feel. Can you imagine how kids who have been exposed to community violence feel? So, up to now, I've made the case that the effects of exposure to community violence are significant by discussing the prevalence of trauma and adverse childhood experiences. I want to pause here and acknowledge the challenge in data on community violence. Although we do have a commonly accepted definition, it is comprised of a number of violent acts. We've mentioned bullying, gang violence, sexual assaults, robberies, the list goes on. Therefore, there's no one system that can monitor or survey the prevalence of community violence. It's not possible to offer an epidemiological, by here I mean prevalence or incidence. We can't offer that estimate of community violence writ large. Instead, we have to deconstruct the concept. When we put all of those things that we've just deconstructed together, it's estimated that 96% of the youth have witnessed or experienced community violence. This seems like an unreasonably high number, but remember, there are both indirect and direct victims. In other words, researchers, clinicians, and policymakers alike must consider the spectrum of effects of community violence in their respective approaches to addressing the issue of community violence. The literature discusses children's exposure to community violence generally in the context of urban environments. In 2009, it was estimated that 80% of the children who live in urban areas experienced community violence. Of those 80%, 70% of them reported being victims themselves. The literature didn't offer an estimate of children who had been both victims or witnesses, or really deconstruct it any more than that. On the last slide, I mentioned indirect victims. Of the 80% of children who had exposed community violence, it could be indirect if they were a bystander, knew the victim, or were cognizant or anxious about the potential for violence. This chronic level of stress has implications for the quality of life and health outcomes for these children. Interestingly, it is suggested that community violence may compound estimations of the effects of child maltreatment. This misattribution of experience leads to an imperfect mechanism for knowing the true scope of exposure to community violence, as well as partner or family violence. So although I've just made the case that comprehensive data is hard to find, it's not the case that data does not exist. The first step in data analysis process is to determine if we want to look at victims or perpetrators. Sometimes available data makes it difficult to disentangle these very different roles. From there, we have to decide what component of community violence we're interested in. I started with the Centers for Disease Control and Prevention, the Division of Violence Prevention. They use a data system called WISCARS, or the Web-Based Injury Statistics Query and Reporting System. It's interactive. You get to create your own reports based on who and what you're interested in and what age range or years you're interested in. I really encourage any and all of you to play around with it. So here's what I did. For the years 2004 to 2012, data was available from Alaska, Colorado, all of these states that you see listed here, including Georgia. And I pulled the number of all victim death counts caused by all intents by a acquaintance, friend, rival gang member, or stranger. And this is for all races, sexes, and ages. So there were a total of 7,170 per 100,000 deaths of all intents caused by these people. This is just for those states that you see listed at the top of the slide during 2004 to 2012. So the crude rate there is 1.11. So in comparison, during the same years in Georgia alone, there were 753 per 100,000 deaths attributable to community violence, a crude rate of 0.89. So numbers alone here, not even interpreting them, you can tell that community violence is an issue in Georgia. Okay, watch out, we're shifting gears. Bullying is another form of community violence I assume we're all familiar with. In recent years, awareness of bullying and the potentially devastating effects of bullying have been prominent in the media. The definition of bullying easily fits into community violence. It's an unwanted, aggressive behavior by another youth or group of youths who are not siblings or current dating partners. The relationship between bully and victim involves a power imbalance, and the interaction is likely to happen more than once. Bullying can have psychological, physical, social, or educational ramifications for the victim. So the CDC estimates that nationally 13 to 75% of children are victims of bullying. Prior research also determined that among youth in grades 9 to 12, females experienced a higher rate of bullying compared to males, 22% versus 18.2% respectively. Bullying can also be electronic, that is, through text messages, web pages, social media, or email. So, since a common definition of bullying does not yet exist, a true prevalence estimate is not possible, but there seems to be a general acknowledgement of the significance of bullying. I want to highlight here an effort by the CDC, including one of my classmates in the doctoral program. The Division of Violence Prevention is working to create a uniform definition and create a national surveillance system for bullying specifically. The citation for this document is on my references slide. I really recommend reviewing it for those of you who are interested or will be working in schools. This document proposes using data elements from 2 already filled out national surveys. So these are the Youth Risk Behavior Surveillance System and the Health Behaviors in School-Aged Children surveys. Putting these together, if it was successful, this would be a significant achievement for the prevention of community violence, and their surveillance efforts would benefit other forms of community violence as well. Bullying is also one of the few acts of community violence for which a national prevention campaign exists. If you go to stopbullying.gov, there's an excellent resource there, which, again, I encourage those of you who will work with or who are working with school-aged children to explore. As it stands now, there is not a reliable assessment of the true prevalence of bullying nationally, which means there certainly is not one locally. All right, at this point, I'm going to shift gears and talk specifically about community violence in Atlanta. Before I do so, I have to stress the difficulty in disentangling family partner violence from community violence. This is a differentiation we make and recognize academically or professionally, but it's not necessarily one that's made by the general population or victims themselves. So I also want to acknowledge that I know I'm only of the community violence to which many of Atlanta's children are exposed. If we can believe the estimates of the literature, the majority, likely somewhere between 80 to 96% of Atlanta's youth experience community violence in any number of ways. I'm going to discuss 3 community violence issues that are affecting youth in Atlanta: bullying, gang violence, and human trafficking. Bullying, of course, is a hot topic nationally and also in the Atlanta public school system. In the first week of March of this year, the news reported bullying and taunting on a Gwinnett County school bus. Much of the bullying is targeted towards specific groups of people, specifically ethnic minorities and LGBT youth. This bullying on the bus I just mentioned had to do with a religious minority. Recall from the beginning of my presentation, one of the points I made was that community violence occurs in places where differences between groups are fostered and they're allowed to exist. Locally, our response to bullying has been led by youth themselves as well as the school system. In 2013, an anti-bullying rally was held at the Martin Luther King Center and was largely organized by youth. Also in 2013, the news featured many anti-bullying events for youth. In December 2014, local high schools, health departments, and my personal favorite contributor here, Usher's youth development nonprofit called New Look, collaborated with Marvel Comic Books to hold an event targeting cyberbullying. The event led students to create anti-bullying efforts in their schools. The Atlanta public school system has a definitive stance on bullying and harassment. I quote, "Bullying and other forms of intimidation will not be tolerated in any form and are strictly prohibited." End quote. Of course, this does not mean that it does not occur. What I found interesting on their webpage was that you could report bullying and harassment and submit the form online. I'd be curious to see an evaluation of this reporting form, especially given the challenge in defining and surveying the prevalence of bullying on a national level. So, next topic. When I moved to Atlanta in 2009, I was told that Atlanta had a gang problem, but the city wouldn't recognize it as such. I don't recall if that was actual fact or just hearsay or maybe something my dad told me to scare me, but compared to other cities that I've lived in, and this is all my opinion, the role and impact of gangs here is downplayed and generally referred to as youth violence or a juvenile gun problem. My very reliable source of Wikipedia, please note the sarcasm there, claims that there are more than 100 active gangs in Georgia. So, in light of my news searching and my very trusty Wikipedia estimate, I'm going to assert that though 100 might not be the true estimate, gangs exist in Atlanta. In 2012, this headline read, "Atlanta street kids become random victims of street violence through rash of shootings." The news story came at the end of a series of shootings in which 4 kids were victims. The shootings reported in the story seemed random to me. They reported that shots were fired into the air or through closed doors in communities. In 2013, the news story reported that 8 members of a violent gang had been arrested on what the reporter calls a bevy of charges. This included aggravated battery, criminal gang participation, trafficking of cocaine and marijuana, possession of a firearm, and murder. The reporter claimed that with the arrest, the public should rest assured that the gang was on the radar. In 2014, 4 arrests were made of members of a gang affiliated with the United Blood Nation. That's right, as in Crips and Bloods. Following this arrest came a summit called Neighborhood Gangs and Protecting Our Youth. To me, it seems like Atlanta's got it now. They know this is a problem. The news report also claimed that Atlanta's crime rate had decreased, but to the critical reader here, what is apparent is instead that violent crime decreased, not crime itself. So, what's the bottom line here? Gang violence happens in Atlanta. Children and youth are exposed to it. Commercial sexual exploitation or human trafficking is a serious and significant social problem for Georgia. It seems to me, though, that only those who are in the know, so to speak, know the extent to this problem. It's my final example of community violence in Atlanta for you. So, did you know that over 400 girls are sexually exploited monthly, or that 100 to 115 underage girls are represented on Craigslist each month? How about that 129 girls are prostituted on a typical weekend night in the city? The commercial exploitation of children is the sexual exploitation of a child primarily for financial or other economic reasons. When this is done by someone outside of their immediate family, it's an example of community violence. This graph depicts the different ways in which girls are exploited. Street activity, on the internet, through escort services, and through major hotels. It also shows trend over time. These numbers are likely not entirely accurate, and they're relatively old at this point, but they make the overall point. It is a sobering fact that Atlanta is one of the highest ranking cities in the world for human trafficking. Local and international girls are trafficked through Atlanta each year. In 2001, it was estimated that between 100 to 300,000 American children were victims, but that number has only continued to grow. The most recent estimate I read was closer to 300,000. So, who are the key players in addressing human trafficking in Atlanta? The Junior League of Atlanta holds trainings and advocacy workshops to raise awareness. They also monitor legislation and seek to help children who are at risk to exploitation. The Jane Fonda Center at Emory University supports the Georgia Care Connection, which provides resources for at-risk or children who have been exploited. I will share the link to the Georgia Care Connection webpage with you, and I really encourage you to hear from a human trafficking survivor themselves what the experience is like. If you're interested in getting involved, the Georgia Care Connection needs volunteers for its Street Grace program. They need volunteers to help with mentoring, tutoring, advocacy, and much more. I know, I'm right there with you. I've told you about the problem, about the effects, and touched on what's being done about it. But what does it mean for us as researchers, practitioners, and policymakers in the field of child welfare? Like I said at the beginning, if we can understand the contextual factors of an outcome, then real change can be made in improving that outcome for children. For me, a child's exposure to community violence, be it in whatever form, all comes back to the trauma of that experience for the child. First, we must be able to assess the trauma. It's perhaps the case that a child has been exposed to community violence but does not display trauma symptoms. We have to approach each child individually and see if the trauma is impacting their overall quality of life. If the child is not displaying symptoms, perhaps discussing it may create new trauma. We must also have routine screening because just because today I'm not experiencing trauma, it doesn't mean that I won't in the future. Following accurate screening and assessment comes proper treatment. A number of treatment paradigms exist. The one I'm most familiar with is trauma-focused cognitive behavior therapy. The interesting part of this treatment for me is that it involves both the child and the parent, provided that he or she is a non-offender. And they're both active participants in the therapy. This is a very public health approach, if I may say so. Finally, it's my opinion that the resiliency of a child should not be overlooked, nor given more credit than it should. That is, children are resilient. This we know. We've read about it. But that doesn't mean that they're bouncing back from these traumatic events. It's our job in the field of child welfare to assist these children in both preventing and treating the trauma that comes from exposure to community violence. I promise this is a non-sponsored pitch here, but allow me. I've done research with the Georgia Center for Child Advocacy in the past, and I believe that you all would benefit from knowing more about them. GCCA's mission is to champion the needs of sexually and severely physically abused children through prevention, intervention, therapy, and collaboration. Their reach doesn't end there. I would posit that children who are exposed to community violence would certainly benefit from their services. So, what have we learned? Community violence is the exposure to intentional acts of interpersonal violence committed in public areas by individuals who are not intimately related to the victim. It is a form of interpersonal violence. It also comes in a number of forms. We discussed violent deaths, bullying, gang violence, and the commercial sexual exploitation of children. We saw community violence is not just a national problem. It's a very real and significant problem in our community of Atlanta. But it's not all bad news. In our future careers as researchers or practitioners or whatever it may be in the field of child welfare, we can make some great change because now we know about the context of community violence and its effect, both short and long term. With this in mind, we'll go forward and create new practices and policies and continue to support children exposed to community violence. Thanks very much for your attention to my participation, and I look forward to discussing any of this with you on Google+.